So, good day everyone. I am Rachel Hilario and I am going to discuss the two disorders which are still under somatic symptom and related disorder, the conversion disorder and the factitious disorder. And also, I will discuss later the specified somatic symptoms and related disorder and also the unspecified somatic symptoms and related disorder. But first, I'm going to discuss the conversion disorder. For its topic outline, we will know what is conversion disorder, its diagnostic criteria, the coding note, the brief history, comorbidity, epidemiology, etiology, and the psychodynamic perspective, its social and cultural factors, and its treatment. For the intended learning outcomes, to know the functional neurological symptom disorder and to understand its brief history. Also, we are going to determine its causes and its treatment. So, for the background of conversion disorder is previously referred to as conversion hysteria and later as conversion reaction and is classified by DSM-5 as a somatoform disorder and by ICD-10 as a dissociative disorder. The newer term functional neurological symptom disorder was introduced as a subtitle in DSM-5, a change representative of the shift away from dynamic and towards descriptive definitions of mental disorder. So, what is conversion disorder? It is known as functional neurological symptom disorder since the symptom happened because your brain converts the effect of a mental health issue into disruptions of your brain or nervous system. So, these symptoms are real but that don't match up with recognized brain related condition. Also, it is a condition in which a person experiences physical and sensory problems. So, it is a mental issue that disrupts how a brain works. And this causes real physical symptoms that a person can't control. So, ang tao na may conversion disorder is makaka-experience ng blindness or paralysis affecting the nervous system that cannot solely explained by physical illness or injury. So usually, it begins suddenly after ang tao is makaka-experience ng a period of emotional or physical distress or psychological conflict. So, an illness of symptoms or deficit affecting voluntary motor or sensory functions, suggesting another medical condition, but judged due to psychological factors because of preceding conflicts or other stressors. So, a disturbance of bodily function not conforming to current concepts of neurological anatomy and physiology. So, it is characterized by the presence of one or more neurological symptoms unexplained by unknown neurologic or medical disorder. So, ang tao na may conversion disorder is nakaka-experience sila ng mga physical symptoms na hindi ma-explained ng mga hindi siya ma-explained ng medical tests and typically occurring it it is typically occurring in a setting of stress and producing considerable dysfunction. So the term conversion has its origins in Freud's doctrine that anxiety is converted into symptoms. So Freud hypothesized that the occurrence of certain symptoms are not explained by organic diseases reflect unconscious conflict. So moving on from its diagnostic criteria. So diagnostic criteria, one or more symptoms of altered voluntary motor or sensory function. And clinical findings provide evidence of incompatibility between the symptom and recognized neurological or medical conditions. So the sensory or motor symptoms begin suddenly, such as loss of vision or paralysis. And the symptoms also suggest that an illness related to neurological damage, but medical tests indicate that the bodily organ and nervous systems are fine. So sometimes, so ang tao daw na may conversion disorder is, for example, maka-experience ng loss of vision or paralysis, magka-feel sila ng partial or complete paralysis sa kanilang arms and legs, seizures and coordination disturbances, or mga insensitivity to pain and the loss of sensation. But the medical test cannot explain it, and kanang nai-indicate sa medical test naman na ang kanilang body organs and nervous system is okay. So, the symptom or deficit is not better explained by another medical or mental disorder. And the symptom of deficit causes clinical significant distress or impairment in social, occupational, or other important areas of functioning or warrants medical evaluation. So, visions may be seriously impaired. Ang vision, then the person may become partially or completely blind, in which the visual field is constricted as it would be if the person were peering through a tube. So, ang loss of the voice, aphonia, isa din ito sa symptom. Then, anosmia, which is the loss of sense of smell. Some people with conversion disorder seem complacent or even serene, are not particularly eager to part with their symptoms, and do not connect their symptoms with their stressful situations. For the coding note, ICD-10, or the International Classification of Diseases, the 10th revision clinical modification code, depends on the symptom type. These are the weakness or paralysis, with abnormal movement, with swallowing symptoms, with speech symptoms, with attacks or seizures, with anesthesia or sensory loss, and with special sensory symptoms, and with mixed symptoms. So, to specify it, acute episode siya kapag ang symptoms are present for less than 6 months, and persistent naman if the symptoms are actually occurring for more than 6 months. So, brief history lang ng conversion disorder. The conversion disorder has a long history dating back to the earliest writing on mental disorders. So, hysteria was the term originally used to describe the disorder, which the Greek physician Hippocrates considered to be an affliction limited to women and brought on by the wandering uterus through the body. So I guess you are familiar with the wandering uterus. So actually, the Egyptians believed that these symptoms, which were primarily seen in women, and it is the women ang unang nakitaan ng symptom ng may conversion disorder, were caused, and it is believed na ito daw ang cause ng deposition of the woman's uterus, or also called the wandering uterus. This was treated dati by placing spices and aromas near sa mouth ng babae, or depending kung saan banda nagmo-move yung uterus. So actually, it was Hippocrates na nag-first coined sa term na hysteria. And the word hysteria comes from the Greek word means womb. The wandering uterus symbolized the longing of a woman's body for the production of child. So, Hippocrates explained na these abnormal movements are caused by various kinds of symptoms like anxiety, a sense of suffocation, tremors, paralysis, and convulsion. He also differentiated between hysteria and epileptic convulsions. He described epilepsy as compulsive movement caused by the brain, while itong hysteria, sabi na it is consisted of abnormal movements caused by the wandering uterus. So, ang treatment ng hysteria noon was much like the ancient Egyptian. So the women were to cure themselves by placing yung mga spices daw in the opposite direction where the uterus moved in order to return to its normal or natural position inside sa woman's body. So also the term conversion originated with Sigmund Freud, who thought na ang anxiety and psychological conflict were converted into physical symptoms. As described sa initial case report ni Anna, yung babaeng pinag-aralan ni Freud and ni Joseph Breuer. Anna was sitting at the bedside of her seriously ill father. So may sakit yung father niya kaya siya yung nagbabantay. And she dropped off into a waking dream. Then, in that dream, she saw a black snake come toward her sick father to bite him. She turned to itry niya na to ward that snake away, but her arm had gone to sleep. When she looked at her hand, yung fingers niya seemed to turn into little snakes with death's heads. So the next day, when a bent branch recalled her hallucination of the snake, her right arm became rigidly extended. After that, whenever some object revived her hallucination, her arm responded in the same way. Yung in-extend niya ang kanyang arm. So later, her symptoms extended to paralysis and anesthesia of her entire right side. So eventually, because of that, Anna was diagnosed with hysteria and spent much of the daytime in a state of anxiety, experiencing hallucinations such as those of skeletons and yung snake na nakita niya sa kanyang waking dream, then possibly resulting from seeing her own hair. So during the day, she would also awake from naps in a state of discomfort and crying. So yun siya ang brief history ng conversion disorder. So let us move on to its comorbidity. Anxiety disorders, especially panic disorders, and depressive disorders commonly co-occur with functional neurological symptom disorder. Somatic symptom disorder may occur as well. Personality disorders are more common in individuals with functional neurological symptom disorder than in the general population, and neurological or other medications and lesions commonly coexist with functional neurological symptom disorder as well. So its epidemiology in the US and Northern Europe, the incidence of individual with persistent functional neurological symptoms is estimated to be 4 to 12 in 100,000 per year. So the prevalence specialty clinics appears to be higher. And 5% of the outpatients ages 9 to 17 in a Japanese psychiatric clinic. And 6% of adult and adolescents admission to an inpatient psychiatric hospital in Oman receive a diagnosis consistent with functional neurological symptom disorder. So symptoms of this conversion disorder usually develop in adolescence or early adulthood, typically after a major life stressor. An episode may end abruptly, but sooner or later, yung disorder is bumabalik naman, either in its original form or sometimes it is with a different symptom. So the prevalence of conversion disorder is less than 1%, and more women than men are given the diagnosis. So for its etiology, the cause of functional neurological disorder is unknown. The condition may be triggered by a neurologic disorder or by a reaction to stress or psychological or physical trauma. But that's not always the case. Functional neurologic disorder is related to how the brain functions, rather than damage to the brain structure, such as from stroke, multiple sclerosis, infection, or injury. So the physical symptoms may come about as a way to try and resolve or relieve whatever is causing the extreme mental stress. For example, ang police officer or soldier who experiences mental trauma from the thought of shooting and possibly killing someone may have paralysis in their hand. So, for example, ang soldier is ma-imagine for example, ay isang soldier na naka-experience ng trauma from the idea na uh, mag he will shoot someone may have caused a paralysis sa kanyang hands. So moving on, still under etiology, the psychodynamic perspective, Freud and his colleague Joseph Breuer developed a psychoanalytic model of conversion disorder by drawing on cases like that of Anna O. They proposed that a conversion disorder results when a person experiences an emotionally overwhelming event, but the emotion is not expressed and the memory of the event is cut off from consciousness. So, a more recent psychodynamic dynamic interpretation of one form of conversion disorder is hysterical blindness, based on a review of two cases of historically blind teenage women. So, one way to understand conversion disorder is that there is a disruption in the normal function of consciousness, such that the person fails to have an explicit awareness of sensory and motor information. So, recent psychodynamic models of conversion disorder focus on the idea that people could be unconscious of certain perceptions and be motivated to have certain symptoms. So, moving on to its social and cultural factors, over the past century, there has been an apparent decrease in the incidence of conversion disorder, which suggests a possible role for social and cultural factors. So during the 19th century, Freud and his colleague Charcot seemed to have an abundance of female patients with conversion disorder. So even in the beginning, mostly talaga ang maka-experience ng conversion disorder are the females. So, but contemporary clinicians rarely see anyone with such problems. And studies shows that diagnosis of hysteria has declined in Western societies such as the US and England, but has remained more common in countries na may less emphasis on psychologizing distress, such as the places in China and India. And during the World War I, a large number of men in combat has developed symptoms kagaya ng symptoms na andoon sa conversion disorder. But during the World War II, the conversion disorder was less common na among sa mga soldiers and occurred mainly sa mga elite combat units. So, whose subculture prohibited psychological expression of distress. So, the result of this study shows that the conversion disorder is more common lang sa mga tao na galing sa rural areas and sa mga tao na may lower economic status. So, moving on to its treatment, conversion disorder is a mental health condition that causes physical symptoms. Because of that, treating the mental health component with some form of psychotherapy is usually the first approach. So the most common types of psychotherapy include cognitive behavioral therapy, hypnotherapy, and group or family therapy. The CBT or cognitive behavioral therapy, this is the most common type of therapy recommended. Experts also considered it the most likely to work. And the hypnotherapy naman, this is usually ang second option for any types of therapy. It may be especially helpful when the symptoms of conversion disorder affect your ability to speak, ability to move, or any of your senses. While the group or family therapy naman, this is the shared therapy experiences na that can help people with conversion disorder. Ang group therapy can help people with this condition connect with others who have similar struggles. And ang family therapy can help loved ones to understand the condition and also to offer support sa person na may conversion disorder. So there are also other treatments that may help includes physical therapy. The symptom of conversion disorder may start with mental health, but the physical effects are still real. Physical therapy can help people with conversion disorder recover from or adapt to physical symptoms. And for the medication, when conversion disorder happens alongside other conditions such as depression or anxiety, medications for those conditions can help conversion disorder symptom also. This is especially true when conversion disorder causes pain symptoms as antidepressant can oftenly positively affect pain levels. Last is the biofeedback. Biofeedback is an alternative medicine approach that teaches people to change the way how their body functions. And it is a mind body therapy that may improve your physical and mental health. So during the biofeedback session, your provided uses monitoring equipment and instrument para ma-measure ang iyong body functions. And based on the feedback from the instrument, your provider will suggest how you will create a physiologic changes on your body. And with education and practice, you can learn to make those bodily changes without the equipment or without sa paggamit ng mga instruments. So, traditional long-term psychoanalysis, psychodynamic psychotherapy, and hypnosis have not been demonstrated to be useful with conversion disorder. Case studies suggest that it is usually not a good idea to try to convince people with conversion disorder that their symptoms are related to psychological factors. Rather, it is better to offer a gentle support sa taong nakaka-experience nito. And it was also suggested that reinforcing a person for being able to improve his or her functioning can be helpful. So that's it for the conversion disorder. I hope you learned something. So moving on sa another disorder which is the factitious disorder. So what is factitious disorder? It is a condition in which a person acts as if he or she has an illness by deliberately producing, feigning, or exaggerating symptoms. So, ang mga tao na may condition na to will go through great lengths such as pretending to be sick. So, an individual fabricates or exaggerates physical or psychological symptoms because they enjoy being in the sick role. Gusto nila na andun sila sa stage ng kanilang buhay na may sakit. Yun. And then, these symptoms are being fake, but they might also be induced. For example, a person might take something or eat something to cause themselves to vomit. And for example is a soldier with factitious disorder might exaggerate or mag-invent na meron siyang anxiety symptoms not because para maka-avoid siya sa combat but because for the attention na marireceive niya from other soldiers or from other clinicians. Whereas both malingering and factitious disorder involve deception, inventing or exaggerating symptoms, the motivations are different. Unlike those with malingering, People with factitious disorder do not deceive others about their symptoms for material gain or to avoid negative events. Rather, they only need attention from other people. So, factitious disorder has actually two types. It is the factitious disorder imposed on self and factitious disorder imposed on another. So first is the diagnostic criteria for factitious disorder imposed on self. Falsification or physical or psychological signs or symptoms or induction of injury or disease associated with identified deception. And the individual presents himself or herself to others as ill, impaired, or injured. The deceptive behavior is evident in the absence of obvious external rewards. And the behavior is the external rewards like economic gain, avoiding legal responsibility, or improving physical well-being. And the behavior is not better explained by other mental disorders such as delusional disorder or another psychotic disorder. So again, people with factitious disorder, they may make themselves sick. For example, they will inject themselves with bacteria, milk, or gasoline, and they may injure themselves or cut cut or burn something sa kanilang parts of their sa kanilang any part of their body, and they may take medication such as blood thinners or drug for diabetes to to mimic diseases. Oh, yun yung mga ginagawa. They are causing self-harm to mimic other diseases. So, ang factitious disorder imposed on another naman, it is when someone falsely claims that another person has physical or psychological signs or symptoms of illness or causes injury or disease in another person with the intention of deceiving others. Gusto niya lokohin ang ibang tao na ipaniwala ng isang tao ay may sakit kahit wala naman talaga. So, the first is falsification of physical or psychological sign or symptoms or induction of injury or disease in another associated with identified deception. The individual presents another individual, yun yung victim niya, present niya to others as may sakit, impaired, or injured. Now, the deceptive behavior is evident even in the absence of external rewards. The behavior is not explained by another mental disorder such as delusional disorder or another psychotic disorder. So, sorry. When an individual falsify illness in another, like children, adults, or pets, the diagnosis is factitious disorder imposed on another. Yung perpetrator and not the victim itself is given the diagnosis. So, yung victim na yon may be given an abuse diagnosis kasi nga pinapaniwala ng perpetrator na siya ay may sakit kahit wala naman talaga. So, if an individual naman with factitious disorder imposed on another has also deceptively presented his or her own illness or injury, both factitious disorder imposed on self and on another can be diagnosed. So kapag pinapaniwala ang factitious disorder imposed on self is pinapaniwala niya na siya ay may sakit, siya ay injured, just to deceive someone. Yun siya ang imposed on self. So, let's move on to its diagnostic features. The essential feature of factitious disorder is the falsification of medical or psychological signs and symptoms in the individual or others that are associated with the identified deception. Individuals with factitious disorder can also seek treatment for themselves or another following induction or of injury or disease. The diagnosis requires a demonstrating that the individuals is taking surreptitious actions to misrepresent, simulate, or cause signs over symptoms of illness or injury, even in the absence of obvious external reward. So, the diagnosis of factitious disorder emphasizes on the objective identification of falsification of signs, symptoms of illness, and not the individual motivations of the falsifier. So, methods of illness falsification can include exaggeration, fabrication, simulation, and induction of injury associated with deception causes others to view such individuals. So, ang individuals with factitious disorder might, for example, they will report feelings of depression and suicidal thoughts or behavior following the death of a spouse despite the fact na ang death is not true or the individual is not having a spouse. So, the main role of the individual there is to deceive. So, also, deceptively report episodes of neurologic symptoms such as seizures, dizziness, or blacking out. They also manipulate a laboratory test. For example, dinadagdagan ng blood sa kanilang ihi to falsely indicate an abnormality. Also, they are falsifying medical records to indicate an illness. They ingest a substance, example insulin or warfarin, to induce an abnormal laboratory result or illness, and physically injure themselves or induce illness to themselves or to another. Although individuals with factitious disorder most often present to healthcare professional for treatment of their factitious outcomes, some individuals with factitious disorder choose to mislead community members and persons about illness or injury without necessarily engaging healthcare professionals. So, how to treat factitious disorder? I know I mean, I will discuss first the epidemiology before the treatment. So, two-thirds of patients with Munchausen syndrome are male. They tend to be white, middle-aged, unemployed, unmarried, and without significant social or family attachments. And 20 to 40 years of age with a history of employment or education in nursing or a healthcare professionals usually ranges from 4 to 79 years of age. Now, for its etiology, the exact cause of factitious disorder is not known, but researchers believe both biological and psychological factors plays a role. So some theories suggest that a history of abuse or neglect as a child or a history of frequent illnesses in themselves or family members that required hospitalization may be factors in the development of the disorder. So most patients with factitious disorder have histories of abuse, trauma, family dysfunction, social isolation, early chronic medical illness, or professional experience in healthcare, like nakatrain sila in nursing or health aid work. Now, moving on to its treatment, the first goal of treatment is to change the person's behavior and reduce their misuse of medical resources. In the case of factitious disorder imposed on another, the main goal is to ensure the safety and protection of any real or potential victims. Now, the primary treatment for factitious disorder is psychotherapy. It is a type of counseling. Treatment likely will focus on changing the thinking and behavior of the individual with the disorder, the cognitive behavioral therapy. Next is the family therapy may also help in teaching the family members not to reward or reinforce the behavior of the person with the disorder. So actually there are no medications that actually treat the factitious disorder. Medication may be used, however, to treat any related disorders such as depression or anxiety. So, moving on from the other specified somatic symptom and related disorder, there are four. The brief somatic symptom disorder, it has a duration of symptoms less than 6 months, while the brief illness anxiety disorder, the duration of symptom is less than 6 months. Third, illness anxiety disorder with excessive health related behavior. The criterion D for illness anxiety disorder is not met. And pseudoiasis, it is a false belief of being pregnant that is associated with objective signs and reported symptoms of pregnancy. So these four or the categories applies to presentation in which symptom characteristics of a somatic symptom and related disorder that cause clinically significant distress or impairment in social, occupational, and other important areas of functioning predominate but do not meet the full criteria for any of the disorders in the somatic symptoms and related disorder diagnostic class. So moving on to the unspecified somatic symptom and related disorder, this category applies to presentation in which symptoms characteristic of a somatic symptom and related disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the criteria for any of the disorders in a somatic symptom and related disorder diagnostic class. The unspecified somatic symptom and related disorder category should not be used unless there are decidedly unusual situation where there is insufficient information to make a more diagnosis. So that ends my report. I hope you learned something. Thank you for listening.